Thiago Alves Pinto, un simposio de la TEIA, del laboratorio de la TEIA, que se llama Bringing EGFR Diagnosis for the Patient When the Time is Essential. El doctor Pinto, el doctor Thiago, es médico especialista en anatomía patológica y tiene un máster en ciencias de la salud. Actualmente forma parte del personal clínico del Hospital de Base y Laboratorio de Diagnóstico del Distrito Federal de Brasil. Muchas gracias, doctor Thiago Alves. Al resto de los expositores, quería recordarles, por favor, ceñirse el tiempo. Estamos atrasados en nuestro programa. Así que, por favor, pedimos ceñirse bien al tiempo. Muchas gracias.
Good morning. First, I would like to thank Atalaya pelo convite, and hopefully everybody's doing well. I would like to congratulate everyone that has presented until now, and apologize for not talking in Spanish. But I'm trying to do an understandable presentation for you. Overall, I'm really pleased to meet you today, especially talking about this compelling topic. Let me try to share my presentation for you. I must recognize that I'm really impressed how this technology can help some patients. Here, I depict my conflict of interests. And so, currently, personalized oncological treatment is guiding decisions, even more than in few past years. High-precision medicine demands more comprehensive molecular tumor profiles. By the way, next-generation sequencing could answer many questions. However, it's time-consuming and costful in terms of infrastructure and staff. So what could be done to abbreviate time while maintaining confidence? Nothing is better to answer this inquiry than showing a real clinical case. Here you can see a woman, 57 years old, weighing a stable 72 kilos, married, holding a history of rheumatoid arthritis, in use of hydroxychloroquine and azathioprine for 10 years. She has 2, a history of a vaguely described asymptomatic lung fibrosis. And 2, she has cursed with slight flu symptoms 10 days before appointment, having progressed from dry to productive cough. And she complained too of some ailment devoid of fever, and had denied hemoptysis. She told has faced a stressful event at work a few days before, and started feeling a chest pain. She has presented to the emergency room, where has been realized a thoracic CT, which has shown the following findings. Here you can see a spiculated nodule located in left upper lobe apical posterior segment, measuring 2.3 per 1.7 centimeters. It was found among ground glass opacity and enlarged lobule sapiens. It was deemed as highly suspicious for malignancy and for lymphangitic carcinomatosis. It was asked a PET-CT, and a transthoracic lung biopsy was feasible, so recommended. The PET-CT has shown multiple highly FDG uptaking thoracic lesions and multiple metastatic backbone lytic lesions too. The core biopsy has been done and sent to the pathology lab. Now, I'd like to reassure how important are pre-analytical steps. Fixation by buffered formalin is one crucial step in preparing specimens for microscopic examination and molecular tests. It would not only prevent decay and preserve cells, but also conserve genetic material. Here, you can see 3 H&E standard sections containing material of the 3 different FFP blocks from the patient. In the tissue section has been detected in the lung biopsy an invasive adenocarcinoma in approximately 80% of the sample. This percentage is used to guide how much of the sample would fit the generic material input requirement of molecular methods. In detail, we can see the papillary and acinar structures. The case was positive for TTF1 and for nepsin A, supporting lung origin. it was ALK5A4 negative, and 2, while ROS1 faintly labeled the cells and it was deemed as negative by the IELTS Atlas. All the line of action described until now goes along with the sense of safeguarding material and rendering timely results. Once the patient in question had a high-burden metastatic disease with both lungs compromised, the oncologist has asked promptly the Idylla EGFR ultra-rapid test. The most interesting fact is that Idylla EGFR only requires one 5 micrometers FFP good quality tissue section to release a extremely reliable result. By taking solely only one rolled tissue FFP section of the appropriate length and thickness and adding it into the cartridge, a lab technician could start a Idylla run. Those steps takes less than 2 minutes on. Inside the equipment, many molecular steps work following a strict track, leading to finally a real-time PCR amplification and detection of mutations. The Idylla EGFR is a comprehensive assay with a large 51 mutations EGFR coverage, including T790M, L858R, and exon 19 deletions. Within only 2 hours and a half is possible to release an extremely careful result and by equalized technology. When talking about liquid biopsies, it is as simple as FFP preparedness. Nevertheless, patient blood must be collected either in EDTA tubes to be processed in 4 hours or in special tubes to be processed within 3 days. Finishing setting up the console and roughly within an hour, the machine would release the result. So, by doing each and every procedure inside the same cartridge, Idylla is able to give fast results at the same time of the pathological and immunohistochemical results. In head-to-head comparisons with other technologies by diverse studies, Idylla has proven significantly reduce the time until the biomarker test result becomes available. Moreover, Idylla EGFR mutation assay can significantly reduce the time until all these biomarkers be released. On the other hand, a lab doing standard qPCR or NGS needs much more expensive infrastructure. Here you can see Idylla and the other types of methodologies. Not even talking about contamination chances and hands-on time. That's why 2 years ago, studying the team in depth, we decided kicking off on the field of molecular pathology by the Idylla platform. It has showed our oncologist partners our aim to give whole results in short time to guide a timely treatment, and most important, has helped many patients to treat and recover not only those harboring lung cancer, but melanoma and colorectal cancer too. Moreover, besides quickness and large mutation coverage, this study from Italy has recently compared the efficiency between Idylla and a NGS platform. While by the Proton NGS platform, 2/3 of the samples resulted in success reports, Idylla detected not only those 43 samples, but also more than 9% of success. So, although NGS is comprehensive, it seems that this technology needs a higher quality and quantity of material to report valid results. This finding has been shown by other recent studies too. Otherwise, Idylla could work across fresh frozen tissue, fresh touch prep, cytological samples, presenting high concordance to reference methods. In summary, despite detecting a wide range of novel mutations, next-generation sequencing often translates into long turnaround times. In contrast, the Idylla system facilitates ultra-rapid assessment of key molecular markers, which can be used concurrently with NGS. Ideally, both methods could coexist. By Idylla results being released besides pathological and immunohistochemical reports, the oncologist is able to start patients' treatment while NGS lab could have enough time to search for actionable variants not described at the first approach. A large academic center from New York has tested this by comparing the Idylla-containing workflow with a standard molecular test, both preceding NGS, showing that turnaround time for rapid EGFR testing reduced from 9 to 1.3 days using minimal material, allowing further testing by NGS assays. So summarizing the clinical case, a L858R mutation has been detected 2 days after the biopsy by the Idylla platform, used the FFP tissue sample of the patient's lung cancer. This EGFR result was released in the same day of the immunohistochemical result, some hours later. After promptly starting the treatment using osimertinib, the oncologist sent the tumor sample to Foundation 1, which confirmed this mutation, releasing their result only 1 month later. So, seeing how interesting Idylla platform is, we would like to offer those tests for all patients. Unfortunately, BioCarps only offers a limited range of cartridges, this one that you can see here. They explain that it's not easy to standardize, validate, IVD approve, and offer a so straightforward method. But they are working on new cartridges as a Gene Fusion Panel 1, which is hopefully expected by us. Here you can see the PET-CT again, the first assessment, how many lesions this patient has. So many of, in here you can see how the treatment how the patient has a good response on the treatment. So many of our EGFR tests nowadays are being made for metastatic patients like this one here, who needs diagnosis and promptly response. And probably one interesting point is, which I couldn't ignore for you, is that it was not only few days after the oncologist has called me telling that this patient has completely recovered by the clinical and image method, I was invited to tell you our experience regarding this platform. So I couldn't miss it out. It has been a pleasure. Having you any doubt or interest on this technology, please contact me or Alatea staff respectively. Thank you.
Many thanks, Thiago. Claramente es una tecnología innovadora y que va a aportar mucho al tratamiento de nuestros pacientes.